To treat almost any condition, doctors prefer medication and other non-invasive techniques first. And when those methods don't work, the patient will likely need surgery. And technology is now revolutionizing how surgery is performed. Dr. Fernando Riccio of Boca Raton Regional Hospital is here to tell us how the new generation of robotic systems is changing surgeries and gynecology. And Doctor, thank you so much for joining us. First of all,
my pleasure.
We are first going to talk about what kind of system you work with now and kind of explain this technology.
Well, the robotic platform has been developed over the last 10 years, and it has taken a lot of impetus in the last 3-4 years, particularly in the areas of urology and gynecology. This technology allows us to operate with a robot operating from a remote console. The endo-wrist technology allows us to articulate our hands in the pelvis, allowing us to do more complex procedures. For example, the most commonly performed procedure in gynecology is a hysterectomy. In southeast Florida, 48% of the hysterectomies are performed under robotic guidance.
Okay. And as a gynecologic oncologist, what are the benefits of this compared to traditional methods, if you could talk about that?
Well, for instance, the hospital stay is substantially decreased. Patients usually go home within 24 hours. The postoperative pain is very minimal, as opposed to a midline muscle splitting incision. And of course, the healthcare costs are dramatically reduced.
As far as a robotic platform goes, what do you have to do to be a candidate for that type of surgery?
Well, you have to have had some background in laparoscopic surgery, and if you have not trained in your gynecological program, you go to train in an animal lab, and after you're proficient and get your certificate, you go to the hospitals and start doing your cases under proctoring with a specialized robotic surgeon, and after you accomplish your cases, then you can start performing your own.
Is there anything specifically the patient has to know about becoming a candidate for that type of surgery?
That's a question that has to be discussed between the practitioner and the physician and the patient.
Okay. When using a robotic surgery system, is the pre-op or post-op extremely different than the traditional methods?
Well, 80% of the time the patients go home the same day.
Wow.
So certainly the postoperative instructions have to be very well delineated at the time of discharge. I suppose when the patient is in-house for several days, you can go over the postoperative care in a slower fashion.
Medical technology changing at a breakneck speed, isn't it, Doctor? Well, thank you so much for joining us. First of all, Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.